You may be dealing with some complaints or suggestion, and in the evening, patient is coming to collect the report, or sometimes in the morning, patients they are saying you send us a report through email or upload on your website. When you are accepting test request, what is required? The patient shall have the test request form properly filled with proper clinical detail, or sometimes they are not filling the test request, but tests are written, doctor's prescription. When you are receiving such request, either in the form of prescription or test request form, which is properly filled, analyze carefully, see whether you have capability to perform the test requested. If you have some doubt, check from your master test list what all tests you are performing. Sometimes patient may be interested whether those tests in the scope of accreditation or not. So you shall have master test list where all the tests are listed in three forms. One, you are performing some tests and those tests are in the scope of accreditation. Second is you are performing tests, but those are not in the scope of accreditation. Third type of test, which you are not performing, you are sending to some other laboratory, outsourcing of the test. And fourth type, some tests may be written in the test request form, which are not in the scope of accreditation. You are not performing those tests, and you are not sending even to any outside laboratory. They have to refuse the patient about those tests. But you should be very clear. Now, if suppose there is some tests which you are not able to perform in the laboratory, or which you are not collecting sample for, inform the patient or a referring doctor कि you are not performing these tests, you will be sending to some other laboratory. If they are accepting, only then you are collecting sample for the other test which you are performing in your laboratory, or even if you are not collecting sample for a particular test, then inform कि we will not collect sample for this test. We don't have facility, but other tests we are able to perform. If you are accepting, only then we will accept the sample. So what I mean to say, people who are posted at the front desk, they should be trained. They shall have training. They have to work in this manner so that patient and clinician get good impression about your laboratory and you are able to perform different activities in a trouble-free manner. Sometimes what happens, some tests may not be clear to you. What is written? See, sometimes patient write BU/SR. Yeah, no, BU/SCR or SC. What they are trying to say, blood urea and serum creatinine. Sometimes they write for peripheral smear, we see different type of request. PBS, peripheral blood smear, GBP, general blood pictures, general blood film. They use different terminology. So if suppose something is not clear, then either clarify with the patient or referring doctor what is this test, so that you are able to perform test in a required manner. And if you are working in a private laboratory, you are charging money, to inform the patient about the cost also. Only after getting customer approval, when the patient is approving that, only then accept the test request. Although in our practice in India, we are performing all tests without doctor's requisition. But if there is any such situation, because some participant may be from outside India, there is any such request कि certain tests you are performing without request, certain tests you are performing after doctor requisition only, then you shall have a list what all tests you can perform without a doctor requisition. If suppose there is a request for test and there is no doctor's prescription or test request form, patient is coming to you and saying, I want to get this CBC and LFT done. Then details are filled in the test request form by the front office personnel in consultation with the patient requesting the tests. You see, you are saying you want these tests. In lipid file, these are included. And CBC, you will get this information. Then after approval by the patient, you are accepting that. And it is all good practice. You are asking patient to sign on that. So that it is clear you are performing these tests with patient consent. Sometimes what happens, some patient may call you over telephone or may come to your laboratory about a test, whether fasting is required or not, how this 24-hour urine sample shall be collected, how this sample of urine culture shall be collected. In this case, you are providing necessary information. Suppose it is related to cost from your master test list and patient preparation from appropriate document, so that they feel satisfied and their all queries are answered. Now, once the patient is accepting the costs and you're accepting their test request form or the doctor's prescription, now you are entering the details in the computer. And you are generating some unique identification also, some ID for every patient by the system. And then you are sending patient to your collection area. It is up to you whether you are generating some information through barcode or otherwise. All these necessary details are entered: patient name, age, gender, referral doctor's name, time, test request, total bill amount, amount paid, amount due. We are doing all these things. A final cash received, issued, what all tests need to be performed, those are also mentioned before sending that patient to your collection area. And always it is a good practice, if suppose it is you are noting down tests from the patient prescription, you keep photocopy of patient prescription with you, so that in the evening while reporting, you can check whether what all tests which were ordered in the test request form, all those are included in the test report or not. And all those were noted down by the registration counter or not. And if suppose patient is coming for any test, for that fasting is required. So before registering patient, check whether it is meeting all patient preparation requirement or not. Suppose fasting is required, 10-hour fasting is required. So discuss in detail with the patient whether the patient is meeting all those requirements or not. If suppose patient preparation is not appropriate, improper, then you are informing patient, the patient has to come back with suitable preparation. And at the time of registration only, you are telling patient, see, we are accepting your sample and you will get the report maybe in the evening, by this time, or maybe next day morning or next day evening, or these few tests, report of these tests will be available in the evening. And for this culture test or some other hormone or some other test, this will be available as per suitability of the laboratory when they are performing a particular test. And you are issuing a slip to the patient and asking them to bring that slip at the time of collecting the report. Now, you have registered the patient, you have collected the amount to be collected. Now you are telling patient to wait for his turn for sample collection. Now suppose you are dealing with some corporate clients or panels. For this, suppose they have defined a list of tests. So you have that approved list of corporate client. If suppose the person is coming, these tests will be performed. How the reports will be delivered, whether the report will go directly to their company or report will be handed over to the patient, and whether the patient has to pay for that client has to pay for those tests, and they are getting reimbursement from their company, or you will get the payment at the end of month or at the end of 3 months from the company. So that, because sometimes what happens, that client may not be aware what all tests need to be performed. If you already have tie-up, so whatever you are approving for certain group of clients, so you shall have details of that. Sometimes what happens, there is a request for urgent tests. Now, front office personnel checking with test schedule, and they are calling the concerned department whether it is possible to perform that test within that time frame or not. If suppose some clinician is saying, I want thyroid report in 3 hours. Otherwise, you're releasing result. Suppose you're collecting sample in the morning, you're releasing result in the evening. So then they are calling the laboratory whether it is possible or not. If it is possible, you are accepting the request, and on the sample you are putting some tag or sticker and the test request form also, so that test request form and that sample is identified as urgent. And also you are mentioning report delivery time. We are accepting this sample in the afternoon at 3 o'clock. The report shall be ready by 6 o'clock. Outside sample may be from your collection center, maybe from your pickup point, maybe home collection. But important thing is, you must understand the test sample shall have with it test request form. And you check carefully whether that sample, because that is not in your control. If you have some pickup points, their people are collecting the samples, whether that sample is suitable for the test to be performed or not. This is important. And also you shall have a list of approved hospital laboratory from where you are accepting the samples. And you know, sometimes what happens, suppose you have 10 collection centers and 10 pickup points, and this you have disclosed in the accreditation. So they are visiting those centers during the assessment. And you are saying we will not receive any sample from any center which is not listed here. So then people at the front office, they shall have a list. If suppose somebody is coming where the name is not mentioned in that list, so then they can refuse that, because you cannot use symbol of the accreditation body on a report where the sample is collected at a place which is not approved by the accreditation body. And if suppose you have facility for home collection, then you shall have details what all samples are collected from the home. When you are providing service, sometimes patients may have certain complaints. Sometimes they may have some suggestion. In complaint, they have experienced something which is not acceptable. In suggestion, they are not unhappy with the services. They may not be unhappy with the services, but they are suggesting to improve the services, to make them more comfortable. Whatever suggestions or complaints they are saying, to those shall be recorded and take appropriate action on that. And also get the feedback from the referring doctors at regular interval and discuss in the management review that these are the feedback received. If suppose some action is required, so that appropriate action can be taken, and keep record of that action. And all complaint suggestions are discussed in the management review. And whatever action you are taking on any feedback or suggestion, inform to the patient or referring doctor also. This was the action taken on your suggestion or complaint or feedback. In the evening, patient is coming to collect the report. One thing is, report is generated by the authorized individual only. It is password protected. It is handed over to the patient by the authorized person only, whom the laboratory has authorized, and it is issued only to authorized person. When front office personnel, they are releasing the result, they are handing over the report to patient, they are checking कि signatures are present on all the reports received from various departments. These reports are segregated ID number wise, and you are releasing result only to authorized patient, and it is a good practice if you are taking the signature of the patient also in the acknowledgement slip, and you are making an entry in the dispatch registers. This is every laboratory is following. Suppose there are some dues, they have paid partially in the morning, rest of the money you are collecting in the evening, only then you are releasing the result. If suppose you are sending some report through courier or online uploading on website, so all these things also shall be entered in the dispatch register so that it is clear. Suppose in the morning patient said, you please email my report, and you have already dispatched the report through email. In the evening, patient is coming to collect the report and you are searching for the report. If you have some information, you are checking the entry of the patient. Oh, you are asked in the morning to send your report online. That has already been communicated. You can avoid many uncomfortable situations. So you are releasing result only to authorized person. Sometimes some patient may come, we have lost the report, or some clinician may ask you. You are issuing duplicate report, the duplicate report only after verifying the patient and identity and approval by the doctor. In this report, you are entering all these things: name of patient, age, gender, referring doctor name, test requested, total bill amount, amount paid, all these things, mode of delivery of the report, all these things you are mentioning in the report. right? Thank you. These are the important things which we have to keep in mind when we are dealing with the patient, because management at front desk shall be appropriate, because this is the place where patients are coming for registration and for collecting report. Yes, anything else you want to ask? Please write in the chat box. Thank you.